Hey guys, Ralph Havens here, Beyond Limits Physical Therapy in Bellingham, Washington. And today I'm going to do a series of strain, counter-strain positions from an advanced integrative manual therapy class that releases the area underneath the diaphragm. So there's lots of little ligaments and structures under here. Of course, you've got your liver and your spleen, and you've got your stomach and your pancreas and all this stuff, your kidneys back here. We're gonna do some techniques that release the pressure here. And what you can do is follow along and then make them your own by using them each day. You'll remember some of them, and you can always use the video over and over again. Each position, you want to go at least 1 minute, 60 seconds. If you could go 90 seconds or 2 minutes, that's even better. So that is something you can do. So I'm going to get right to it, and then we'll get started. So hopefully you can see me. Yeah, I might be moving this around a little bit. Okay, so the first position is like this. You put your hips and knees and ankles at 90 degrees, and then you're going to flex your chin down just a little bit, just like that. And you're going to roll your collarbones down forward just a little bit, and then right about here you're going to bend a little bit. And then hold that position, and you're going to lift your right heel about 2.5 inches off the floor and just hold that for a bit. So it's a kind of funny position, but we're going to hold it for about a minute. I've got an eye on my clock. And these put you in a very specific position that takes pressure off of areas underneath the diaphragm, and it releases tensions. So you'll feel different afterwards. And the tough part is just holding positions for about for 60 seconds or more. This is for a little ligament called your ligament of Treitz. It holds part of your duodenum in place, which is part of the small intestine. We have about 20 more seconds or so. And special thanks to Tom G. Mateo and co-developer of Integrative Manual Therapy for these techniques. That's IMTWellnessCenter.com. Okay, and then we can relax there. So the next one, we just go through it, is for another ligament around the duodenum, part of the small intestine. Your hips, knees, and ankles are at 90 degrees, which just means at a right angle. You're going to rotate your body, the upper body to the left about 15 degrees, and then tilt your right shoulder down around 15 degrees, and then flex just a little bit right here, as if somebody's pushing you in here just to hold you down. And then we'll hold that for a bit. I'll do my best to keep my eye on the clock. So at home you would want to do it with a clock close by so you can see. Some of you may feel a little relaxation or a little unwinding, a little mobility, a little motion happening in your belly, but others don't, and it's okay either way. You have about 20 or 30 more seconds to go. I feel my body unwinding quite a bit. And again, you can hold these longer than 60 seconds. It has a bigger total body effect if you hold them longer. In fact, I think I'll hold this one just a little bit longer. and then relax. Okay, the next one is for a ligament that connects your liver and your duodenum. And your hips and knees are at 90 degrees again. You're going to put the back of your left wrist on top of your right knee, and then you're going to sit on your right hand. And then you're going to bend right here. You're going to turn your neck to the left 10 degrees, and then you're going to flex your chin down about 5 degrees and hold that for a little bit. We'll just hold it real still. Some of you may be feeling a little unwinding, a little relaxation. We're going a little longer than a minute just because I want to make sure we get at least a minute. Okay, then relax. Okay, the next one is for a ligament, the area between your pancreas and your spleen. And so what we're going to do is hips, knees, and ankles at 90 degrees. The right wrist is going to go on the left knee, and you're going to sit on the left hand, and you're going to bend the body to the left bend and turn the body to the left about 10 degrees, and then turn the head back to the right about 15 degrees and tuck the chin down. We hold this for another 60 seconds. Since I can't see the clock, I'll just estimate. We'll make sure we get at least 60 seconds in. And just stay nice and still. You can feel what's happening in your body if you like. It has a profound effect on the area underneath the diaphragm. We'll hold it just a little bit longer. Again, if you hold it longer than 60 seconds, you have a more complete total body effect. Okay, then come on back around. Okay, the next one, we're going to take a couple of books, or a book that's 2 inches thick. Just go 2-inch thick book, 1 inch, 2 inch. And you're going to put your hips and knees at 90 degrees, and your left heel is going to go on top of the book. So just your left heel. And then you're going to rotate the trunk. This is for a ligament between the liver and the stomach. So you're going to rotate the trunk to the left 20 degrees. The right hand is going to go palm down with the right thumb just on the inner edge of the knee, like that. And then the left hand, the little finger side of the hand is going to go over there on the right pocket area. You're going to flex the head 5 degrees, turn 10 degrees to the left, and then bend 10 degrees to the right, and hold that. Yeah, profound effect on the area between your liver and your stomach. Hold it a little over a minute. Hold it a little bit longer. Okay, and then relax right there. You can take your foot away from the block that you're on. Okay, and let's see. We've got 2 more of these to do. This is for the big transverse abdominis muscle. So what you're going to do is hips, knees, and ankles at 90 degrees. You're going to wrap your hand around, right hand around your body so that the right thumb is pointed straight up on the center line. You're going to put the other hand right here and then hold this up and then turn it in just a little bit. And then just kind of flex just a little bit where the lower arm is. You go another minute. We have about 20 more seconds to go. Okay, and then we do the same thing to the other side. So left hand goes over on the side, and then right hand goes right there, and then you lift up, and then you go in, and we hold this for a minute. flex a little bit where your lower arm is, just a little bit. And again, some of you may be feeling some unwinding, some relaxation. It's okay if you don't. About 20 more seconds to go. It's been a minute, but I'm going to hold it just a little longer. Okay, and relax, and we have one more. Hips and knees at 90 degrees, ankles at 90 degrees. You're going to put the back of your hand, or the hand, right on the bump on the back of the head. And then your left wrist is going to go about 5 inches below this little bone on the side. So we can count 1, 2, 3, 4, 5. Just kind of plant your wrist there. It's mostly to bend your body a little bit. So you hold that. Then we're going to turn to the left 30 degrees and bring your right shoulder to point forward, or your right elbow to point forward. So 30 degrees at the head. And last one, we'll do a minute. That's it. And I think I'm actually going to show you 2 more that are very easy. They're also in some of my other videos, but we'll might as well do 2 more because they're just right there. Okay, and then go ahead and relax. And yeah, I'm going to show you 2 more because it's just they're easy to do, and it's for the whole liver. We slouch, kind of like a teenager. You turn to the right about 30 degrees, and you tilt your left shoulder down about 35 degrees, and hold that for a minute. Again, this is in some of the other videos, but because it's just right there, we're going to just do one for the liver and then one for the stomach. So this one's for the liver. We'll do 1 minute. A little bit longer. Some of you may notice how much more relaxed you feel. Okay, and then for the stomach side, we're going to slouch, turn to the left about 35 degrees, and then tilt your right shoulder down about 20 degrees and hold that for about a minute. Okay, then come back around and then see how you feel. Walk around, check it out, let me know. My name is Ralph Havens, physical therapist here in Beyond Limits Physical Therapy in Bellingham, Washington. RalphHavens.com and 360-599-2217. If you're dealing with a chronic injury or health challenge and doctors don't have answers for you yet, reach out to me and we can do a mapping assessment and find what the primary root cause is for you and get you back on the road to health and living the way you want to live. All right, you guys, talk to you soon.